Good morning, Singapore. It's Glenn and the Flying Dutchman with Andre and Shaun. And of course, today being Therapy Tuesday, we have the one and only, the beautiful Dr. Geraldine Tan. Good morning, Jerry.
Good morning.
Okay, Jerry, this morning we're going to be talking about, I guess it's a condition, being bipolar.
Yes, so it's a mood disorder.
Yeah.
Bipolar is in the past, it has many names. It was called manic disorder, manic depressive disorder. So there were many names that it went by. But I was very interested because Glenn was the one that was quite excited about the topic last week, because you said you had a friend that had it.
Yeah.
So you have an idea what it is like.
Yeah, it's like, split personality? No, not split personality.
That's a personality disorder.
But, this person would just, would be quite difficult to deal with because emotionally, this person was rather unstable. So, one day, the person was okay. The next day, kind of edgy, that kind of thing.
Yeah.
Right? Is that bipolar disorder?
Well, it doesn't really quite describe a lot of things, right? Many people are quite difficult to deal with.
Okay, but what is being bipolar? What is the disorder?
Okay, so there are different facets of it. So the big one would be the mania that we are looking at. But there is mania and there's hypomania. So let me try and explain all the terms. Today a lot of glossary, explanation.
Ooh.
So hypomania, let's go with hypomania. It means just below mania. Okay. And it has someone that takes a lot of risks. So you see these people taking a lot of risks, like buying sprees, making investments, just highly sexualized sort of behavior. Yeah, so they sometimes can be quite promiscuous. They can be quite heightened, very wired. Oh, I can do anything. I can do everything. I can conquer the world sort of feeling. Some of them do start many projects during this period of time. So it's quite a sight to see them operate within their hypomanic state. Yeah. And when we look at mania, which is one up hypomania,
Right.
It's when they sometimes put themselves in danger. And many times for this category of people, so there's bipolar 1 and 2. So bipolar 1, the mania state can last for about a week, and it's severe enough to be hospitalized.
Oh, wow.
To hospitalize them, yeah.
Just a regular hospital or mental hospital?
Mental hospital or mental ward.
I see.
Because, for example, they are very highly sexualized.
Oh.
So they would be just going around being very promiscuous, and they cannot stop.
Oh, we never knew that was part of,
I didn't know that,
bipolarism. Okay, so but that's level 1 you're talking about, right?
Level 1, so that's the serious one, okay?
Right.
And then when the whole manic state is over, they can fall right into that depressive state. So those with major depressive disorder will identify with this state, just that bipolar 1 can have both states occurring.
Oh, I always thought when it came to bipolarism, it usually involved people who had mood swings and who would get angry all the time. I never knew.
You see, things like mood swings, I think that may not necessarily be bipolar. That could also be thyroidic.
Oh, is it?
Yeah.
And what is that?
I'm getting confused now.
Okay, let's not talk about that. The thyroid is something completely different from being bipolar.
Okay, wait. So
Like
that's
when you have
hypo-
thyroid issues, your face kind of swells.
No.
Is that
no?
so? That's different again.
No.
That's different.
Okay, so hypo and hyper, is that what you're saying?
No, hypomania and just mania itself.
Okay. Mania.
Yeah. So it's very exciting because a lot of people, don't understand and they think that there are a few, so mood disorders or one day happy, the other day not happy, and they say, okay, you've got bipolar. You swing from one mood to another, so you've got an issue.
So it's not the case, yeah? Okay.
No.
Okay,
No.
so
Man, I've been labeling so many people bipolar.
And they may
Looks
not
like
be.
I've been wrong.
yeah. So Jerry, what causes this? Is it a chemical imbalance? Is it what?
It can have several issues. So one, it could be genetic, it could be a chemical issue. So many times for disorders like that, they would need medication. Yeah, so they would need some form of chemical help for them.
Okay. We're talking to Dr. Geraldine Tan because it is Therapy Tuesday, and today we're talking about bipolar disorder. We will continue to talk about this live on Facebook. In the meantime, here's Madonna with music on 1FM 91.3.
So Jerry, not all bipolar cases need medication, or do all bipolar cases need medication?
That's a tricky one. So the bipolar 1, we would encourage, because of the instability of the mood and the unpredictability of the mood, for them to go on medication. Yeah, but sometimes when they are in that manic state or hypomania, they feel, I don't want medication. I'm on top of the wall. And they can be quite talkative.
But what's wrong with that? When you were explaining bipolar 1, they're on top of the world, they feel like they can conquer anything, but you never say anything about them putting themselves in danger of being highly sexualized.
Oh, yes, they are. That means the mania, the hypomania is this level, right? Mania is one up.
Okay.
So it encompasses whatever hypomania has. And it takes it to another level.
But hypomania, just now when you're talking about it almost sounds like, wow, this person is quite amazing. Also,
Yeah, but then again, I was thinking when she mentioned that this person is like highly sexualized and stuff like that. So, what's the possibility of, in the past when someone gets arrested for like rape or something like that the rapist is bipolar. There's a high possibility of that, right?
Yep. Well, we don't know until the court psychologist, diagnose the person. So it's a bit hard to say.
Or a serial rapist. A serial rapist may be bipolar.
Maybe, but you've got to leave that to court people to do that. They
I would like to declare all rapists bipolar right now. How about that?
Can't do that.
Okay, I can't do that.
Nonsense.
That's why you see, I label people just like that.
Oh, but then if you do that...
I have to stop doing that.
Yeah, because...
Like yesterday, right? Yesterday you got a bit angry. I was thinking, hey, maybe Andre is a bit bipolar.
Yeah, see, Jerry, he's starting.
So I think, no, I shouldn't be like that.
No, you shouldn't.
Yes, thank
Okay.
you.
So go on, Jerry.
Because you just call all rapists bipolar, and now you call me a bipolar.
So
Sorry.
mania is a heightened condition compared to hypomania.
Yes.
Okay, which
Yeah.
means
And it's more
these people could have. Let's see if I'm getting this right. These people could have so much confidence, so much passion that it could turn dangerous for them.
Yes.
So they no longer have our normal boundaries that we surround ourselves with.
Very good. You're very
Hey,
good student.
I'm telling you, I'm learning from Jerry, man. I'm getting good at
You're a
this.
bit bipolar, no? I
Okay.
think.
So Charmaine Lee, one of our friends, says bipolar personality is like a roller coaster. Is that right or wrong? Because when we were talking about people who switched their moods, that's what we were talking about when we spoke about roller coasters, right? So is it a roller coaster for people suffering from bipolar?
It feels like, and many times they struggle with it, although it sounds very fun, right? They can be very talkative, they can do a lot of different projects, but remember that they also swing down to that depressive state.
Oh, okay.
Okay.
Yeah, so if we've read about depression, we kind of hear about depression. So imagine they take it up so high that down can be quite down, and they lose interest with everything. So one period of time they can be doing all the projects and really on top of everything. The next moment they can be just flat on their beds and they can't move at all. They don't even want to pick up their phones. So it's very tough for them actually.
So are these the kind of signs we should be looking out for if we suspect someone in our family or our circle of friends is bipolar? What are these the only signs?
Yeah, what are the classic symptoms? Maybe you should save that for on air. Classic symptoms so that people can also. So okay, let me read some of the comments our fans have. Okay, so the same person, Charmaine, says they tend to talk very fast, and they think that they have superpowers. And when in manic states, they could go without sleep for days. Is that true? Also?
Yes.
Wow.
So some have reported like weeks, for a week. So someone came into the hospital for a week not having slept at all.
What?
Yeah. And it's not actually very far away. We have many celebrities, many well-known personalities with bipolar disorder.
But you see, all those personalities are all high on cocaine. You see.
No, they weren't.
No, it's true. Like in the States and all that, I know that for a fact, because they take the drugs and all that, and that keeps them awake. But here in Singapore, it's very hard. You don't have that. So for someone to not sleep for, you were saying, a week, right, is amazing.
Yeah.
Remember that there is a shift in the chemicals in the body, right? So, the sleep-wake cycle, there needs to be that natural rhythm, the natural shift in your chemicals. But they don't have, for that period of time, or there's a lack, or there's too much of. Right. And therefore, it leads to the body reacting in a certain way. Yeah.
Okay, that means that person I was trying to describe earlier on without revealing too much, because you asked me, right, about this friend. I didn't want to say too much because, in case some people may figure out who I'm referring to. But I just realized that after what you've just said and described, that person was not bipolar.
No.
That person was just a brat.
It's worse.
It's true.
It's worse.
Okay, yeah, that could be. That could be.
Why are you asking FD, right? FD, do you know this person?
I never mind.
I'm asking you also. You
I don't
know this person as well.
I do?
And so does Shaun.
Oh.
Yeah.
Okay, just moving along.
Okay.
No, I'm trying to...
Yeah.
I'm trying to take it away from you. See, you know what I mean?
Okay.
So Uruk Wong says my in-laws must be bipolar too. I do not know what he means by that.
Because there's bipolar 1, so then there's bipolar 2.
Okay.
Yes, there's bipolar 2. So mania is bipolar 1. The mania and the major depressive states.
Right.
And then the bipolar 2 has the hypomania and also the depression part of it. But not everyone falls into 1 and 2. So there is cyclothymic disorder, which doesn't quite fit into 1 and 2. Yeah, but they also have that cycle. And some of these are very functioning people that are working amongst us in different professions.
How do you diagnose? Okay, I'm going to ask you this on air, okay, Jerry? Stand by. Like a midget.
Little Miss Dynamite.
Anyway, okay. So we are talking about bipolar disorders, and now I know why when we talk about bipolar, we're talking about bipolar disorders because as Jerry has been mentioning, there's so many levels of of a person being bipolar.
Yeah,
Almost
well,
like a
that-
spectrum.
Yeah, well, there's one, there's two, and then there's a third one where that doesn't really fit in one and two.
Yeah.
But and Glenn was going to ask you this: how do we know that someone is bipolar? What signs do we look for? How do you
What-
guys diagnose it?
Yeah, what tests do these people have to go through?
I mean, the easiest one is when the family members bring them in, bring them to us, right? And typically you will see, so for the individual or the people around them, the easiest way is to see that shift in energy, where they have a sudden drop in energy,
Yeah.
and it's very atypical, or there is an increase in the energy level. So they can be very heightened or very wired, or very jumpy. And the switch is quite apparent sometimes, okay? And the irritability, they can have a little bit of that shift in their own personality because of the energy level. So the mood is observable. Yeah.
Right.
Okay. Then we have the decreased need for sleep during the hypomania periods, that inflated self-esteem, I can do anything, very talkative, more than usual. So I must add that, more than usual. So you can actually notice like, hey, how come you're talking so much today? When they speak to you or when they do things, they jump from one thing to another because of that energy level. Okay, so they hop from one thing to another. So sometimes there are a lot of that behaviors I was talking to you about, a lot of risk-taking behaviors. I cross the road, I don't care, I'm bigger than the car sort of thing. So they take risks without thinking about, the consequences sometimes. Yeah.
Are there physical or mental tests that you can give people to find out if they're bipolar?
Yeah. If someone listening in right now or watching, right, has always suspected that maybe he or she may be having a bipolar disorder.
But I don't think you would know. I think that people watching
Yeah.
you would realize because you are in it, It's like me watching you, like, how come, like Glenn is so on top of the world today and then the next 15 minutes you are... Okay, does it happen like that? Like they can immediately be on top of the world and then 20 minutes later be depressed? Or is it like it takes days?
We don't see it immediately as you're watching them, I don't think. Yeah, but it can be from one day to another. Yeah, so there is a marked difference in the energy level from one day to another. So someone that just switched in front of you is quite scary. I mean, that's when Glenn was saying split personality, right?
No, because I mean, at the most extreme, you mentioned level 1 just now. It was quite scary.
It's scary. It's scary.
It was really scary, I mean, if I had a family member like that, for example, and I don't mean to make fun of the situation, although there will be people who will laugh. It is almost like this person is possessed.
Yeah,
what I mean?
It could seem that way.
Yeah, and if I'm the really staunch kind of person, I would not take the person to IMH. I would take the person to Novena Church.
Yeah. No. I see where Glenn is coming from.
You know what I mean?
Yeah. It can be misinterpreted.
I don't think they appear possessed. They do very logical things. Remember that many of these people are just like you and me, and some of them that I've seen are actually very intelligent people and very accomplished people. So there was one older gentleman that was really, really sweet when he came into the hospital. One of a very accomplished man, and he definitely can afford it, but he would, in his mania state, right, go around buying cars, buying sports cars, buying condos, writing checks, and I've got a lot of money, just take it, and he will sign it, and his children will have to go and track where he went and start retracting all the checks and apologizing to all these different organizations. Yeah, so but he, after the whole thing, I mean, he knows what he is doing, so he feels very apologetic. But in that state, he was not able to see that he was in the mania state.
Right. So now you know. You saw Andre's face just now. He was thinking Rod Montero. Because Rod used to buy like 30 over motorbikes and still buying cars. Because I saw you like kind of wink at me just now.
No, I was pointing at you.
Me?
You.
Why me?
Because you change your cars
Well,
every 6
sometimes,
months.
yeah.
Yeah, but Rod is worse.
I'm not saying anything. Well, I'm talking about you. He's not here to defend
I think he's
himself.
bipolar. No.
I mean, he's bought a lot of motorbikes, but
Maybe he just has a passion for motorbikes
Yeah,
and he's
Glenn.
not bipolar.
Rod Montero, I think you're bipolar. Brother, I think you're bipolar.
you're an
Okay.
idiot.
Okay, come. I've got a question for Jerry in a while regarding this chemical imbalance situation.
Okay, it is 8:22.
1FM time check by budget.
I can't believe you said that on radio. That Rod is bipolar.
I didn't say it. You said it.
I know you're thinking
I'm
that.
gonna message
Here we
him
go.
now.
Here we go, Jerry.
Because
Here we go.
You're looking at me, and I'm like, okay. I know
wait.
what you're thinking.
There's only one. There's only one fella here.
No, you don't.
Who
come
said
and-
it? Who said it? Did he say or I say it?
I didn't hear anything.
No
I wasn't
lah.
paying attention.
I knew what you were thinking. That's why I was
Yeah,
just
yeah, he
echoing
was
your thoughts.
reading your mind.
Yeah.
Fool.
can I-
This is his brother-in-law. No, who's a snake now. You wait till I message Rod.
Can I
Okay,
ask
the fellow
Jerry?
don't pay my bill.
But Jerry, this friend of ours, how many motorbikes
15.
Why
at that
is
time?
he the subject?
No, in Singapore, when you were in Singapore.
15.
15, just kept on buying and buying and buying 15 motorbikes. Until the condos car park had no more space for the rest of the residents.
That's true.
Yeah.
He took out like 4
Don't you think only a bipolar person will do that?
A collector does that too.
Thank you, Jerry.
Every, everybody's laughing and saying thank you.
Why?
He's got 60 watches.
Oh my God, that's right. You are also bipolar. Oh dear, everyone's bipolar.
No, but
it's not
Jerry,
so bad being
Jerry,
bipolar then.
This condition, I mean, we can go through our lives, and this condition can hit us at any point, right?
There have been children and adolescents diagnosed with it, yes. And if there is a family history of bipolar in the family, in the bloodline, the children may have a higher chance of having this disorder. Yeah.
Has science discovered or proven any particular triggers that would start a bipolar condition? Things that would trigger this?
Yeah, unfortunately, it is very. There's no clear cause. There's no clear trigger.
Right.
When you are or have been diagnosed with it, triggers like stress can definitely push you into a state.
Right.
Some of it is cyclical. So that hence the cycle of the mania and the depressed state.
Okay. If there's anyone out there who has a question for Jerry, okay, please state your question on our Facebook page right now so that Jerry can answer your question. But back to what we're talking about today, bipolar disorders, right? I've always wanted to ask this question. The word bipolar.
Yeah.
All right. How did they come up with that term, bipolar? Is it because bipolar doesn't sound like a mental thing. You know what I mean?
Two extremes, I think.
It's
is
just
what-
based on the word poles and by two. So two, I don't know, I'm just guessing. Would
Yeah,
it be
which
right?
is why it's not wrong for people to assume that someone is bipolar if the person has mood swings all
That
the
is
time,
true,
right?
That is
Yeah.
true. That is
You know what I mean?
Yeah.
But when someone has mood swings, they swing to many different moods, you see. They don't
Okay.
swing to only two
Right.
extreme.
But I do know of some people, one moment they're in a good mood, next moment they're in a bad mood. So it's always good mood, bad mood, good mood, bad mood,
That's called getting old. man.
That's true. Not, I wasn't talking about me.
No, I know you were talking about me.
So the bi doesn't stand for bisexual or what?
Oh, yeah.
Nice too lah.
Right. Because just now you're talking about like, some bipolar people are very sexual. No? So I was thinking like maybe the bi in bipolar
No.
is
Okay,
for...
stand by.
Okay.
No, yeah.
Cut you off there, right?
You guys are just confusing Jerry, Stop it.
You are
Okay.
confusing Jerry.
Anyway, bye.
91.3 traffic.
Usual delays across the expressways this morning. That shouldn't surprise you too much. Let's see if you have any other major issues to look out for. CTE towards the SLE. A vehicle broken down after the Bradle Road exit. Look out for that. And on Upper Serangoon Road, traffic lights are faulty. Stay within the speed limit. Make sure you've got everyone buckled up. Be safe as you drive today.
Good morning, Singapore. It's Glenn and the Flying Dutchman. Andre and Shaun are here. Dr Geraldine Tan from the therapy room is with us as well. We're talking about bipolar disorders today. And, okay, so this is what Andre has been wanting to ask you, Jerry. Okay? Andre has always felt like I'm bipolar. So how can I find out if I'm really bipolar?
Yes,
Look in the mirror.
Can we test him? Is there a test that are there questions that we can ask? Should we take a blood test?
We've been talking to Jerry for quite a while now,
Yeah.
for many weeks now. I think if I were bipolar, she'll be able to tell right now, and
No.
she'll say, "Glenn, you are bipolar."
No, I'm sure there's a test.
I think Glenn is just wanting to sit on the couch in my room. That's all.
That's why she's the best. No, Jerry can read my mind already. Jerry can read my mind better than you, Andre.
Because of the lies that you tell, it's so hard to keep track.
Okay, go on. No, we have questions.
You wanted to ask him.
Speechless. Oh my gosh.
Yeah,
We've rendered him speechless.
This is you.
yeah,
You made
yeah.
me speechless.
Okay, Andre, you had a question. You had a question for Jerry, right?
Okay, so some of our fans are asking, are some of the people who are really depressed, do you use electroconvulsive therapy on them too?
ECT is one of the extreme methods that the doctors will use,
Oh.
especially when the depression is extremely prolonged and severe. So there severe meaning there is harm to self, harm to others. The thoughts are just too pervasive. So then what they'll do is to do the ECT just to relieve the symptoms for a little bit. Yeah.
So how is ECT administered? Is it like when you have a heart attack, those pods?
Okay. Okay. So the ones that I've seen is that the GA is administered and it's very quick and very fast, yeah. And then the electrical current is passed through the temples.
Oh.
Very fast.
Wow.
Yeah.
Oh.
So the person has to be put under first.
Yes. And when you're under the GA, it's just a little bit, and then they put they do the ECT.
Oh, okay.
Wow.
Wow. Okay, that's quite interesting.
You got to feel for people who are suffering from
No, and
from these conditions, be it like depression or after they're diagnosed as
And you need to
having a bipolar disorder.
You need to be able to understand them and to I think what they also need is a lot of support, a lot of encouragement rather than people just going, you're crazy.
Yeah.
Because that's what a lot of people would do, and you can't do that to these people because they have a condition that they are trying to treat. You know?
For people who don't quite understand, I mean, just recall that one time, maybe you had this mental anguish as a result of something, and imagine going through that every single day.
Yeah.
That's what some of these people go through, and
Yeah.
it's wow, I can't imagine that.
And many of them are trying to be, trying to do an honest day work just like you and me. And they cannot focus. So it comes with all that depression symptoms, right? They cannot focus. They are unable to complete their work. They feel very tired, lethargic, and then they go into these manic states or hypomania states. And then people look at them with weird eyes. So it makes that whole socializing even worse. Yeah, so you don't have friends like, all of you, right? Where you all would laugh at them and just still be the buddies. But, many people get quite frightened by their behaviors.
Right.
Yeah.
So Gladys is asking, for someone who has bipolar, do they have to take medication forever or can they be cured?
Any of these disorders can be managed. So we don't use the word like, oh, you're cured from it, but it can be managed. And you need to be regular with your medication. You need to be regular with your talk therapy. That means we work hand in hand with the psychiatrist. So the psychologists work hand in hand with the psychiatrist. So sometimes they say, oh, I don't want, I don't want to take a medication, or I don't want my psychotherapy, or I don't want my psychologist. And sometimes they are not able to sustain the management of it, Yeah.
How does this, if we have ladies listening to us right now, how does this medication come into play, say, if we're talking about having children?
So the psychiatrist will monitor you, and they would work with the different dosages or a medication that you can manage through your pregnancy. Yeah.
So there is medication that you can take that will not affect, say, the child, for example, or affect your breastfeeding or something like that.
The doctors will generally work with you
Yeah.
with so there are many different types of medication out there.
Okay.
And the doctors probably would be able to toggle the medication for you. So
Okay.
difference between psychiatrists and psychologists. So I'm a psychologist.
Yes.
Psychologists are not medical doctors. Psychiatrists are medical doctors that can administer medication. Both professions can do the diagnosis, okay? And we work in tandem most of the time. But of course, for those that require medication, we tai chi over to the psychiatrist.
Yeah.
Okay.
Which is great. So the first
Yeah.
person you see should be Jerry. And then if anything, if Jerry feels like, you need a little bit more, she will refer you to a psychiatrist.
True.
He's still trying,
One session, Jerry. Just one. Anyway.
You know, the problem with this is, if Jerry has you on her couch and has a session with you, she may give up her career.
We have many questions. We'll come back.
All right. We'll come back and answer a few more questions on Facebook.
Yes.
But thank you once again, Dr. Geraldine Tan, for joining us today for Therapy Tuesday. It is 8:33.
Glenn and the Flying Dutchman.
Okay.
So
a
Adrian
few more
Tan is
questions.
asking, what is the population, what's the percentage of the Singapore population who have bipolar disorder?
I don't have the percentage on hand. I'm so sorry, Adrian.
Okay. Do bipolar, people with bipolar do they experience hallucinations?
Yes. So it can comorbid with many different other disorders. So it can comorbid with anxiety. Some of the more severe ones can comorbid with auditory and visual hallucinations. Yeah. So it is possible. So there was one of the girls that had things jumping in my room.
Oh,
Yeah, I literally had to ask her, is it here? Where is it?
that's
And
scary
ask her
too.
to describe. No, I mean it is quite fun when you talk to them about it, and they truly believe and can see that it is there. Yeah.
So which gender is more prone to such a disorder? This is a question from Dawn.
The women, of course. Because the women
No.
think a lot.
No, I don't know. Don't know about that.
Are quite equal, actually.
Really?
Yeah,
Oh.
yeah. We've seen an equal number come through the doors.
We
Yeah.
I deliberately said that, by the way. It's just
we've got another listener who said that the bipolar condition goes in cycles, anywhere between a few days and a few weeks. It's
Wow.
difficult to get out of the state, and it's almost consistent. But with severe depression, I tend to stay in the down state longer than in the up state.
Oh, is she saying that she is bipolar?
Yeah. and she tends to stay in the downstate longer than the upstate.
It's not good then.
Typically, the downstate seems to be longer. Yeah.
So is it a safer state to be in? I'm just wondering because you say when they are on the upstate, it gets dangerous.
Yeah. So a little kind of insight, right? So when they are very, very down at the lowest point, they are too tired to do anything at all. They can't do anything. But when they start to recover a little bit or get a bit better, that's when it is very dangerous. That's when we look out for suicide.
Ooh.
Wow. Wow.
Yeah. So sometimes on the upswing or when they're getting out of the down state, they feel a little bit better. They have a bit more energy, and that's when they feel extremely frustrated with themselves.
Right.
And that's when the hopelessness, helplessness just consumes them so much that they tell themselves they're better off dying.
Wow.
Oh, that's sad.
So Jerry, that same listener says, do you have any advice on how to get out of the downstate quicker or easier? Is there anything they can do?
I mean, when they're in upstate and downstate, I will always encourage them, please listen to your family members, because at that point in time, sometimes you don't have the strength or you can't bring yourself to drag yourself to the different professionals. And that's exactly when you need the help, you see, and take the medication to ensure that you go for your therapy and do all the exercises that or your therapist or the psychiatrist have told you to. So receiving the help around you becomes very important.
Okay.
I think it's also very important, that people know the helplines to call, as you mentioned, right? I mean, Andre and myself are trying to raise awareness when it comes to mental health issues. We've been doing the 25 push-up challenge for 25 days,
Yeah.
Okay, stand by.
FM 91.3 traffic.
CTE towards the SLE, a vehicle broken down after Bridle Road exit. Usual delays across the expressways. Look out for the Upper Serangoon Road. Traffic lights faulty there. Just stay within the speed limit, folks. Make sure you've got everyone buckled up. Be safe as you drive today.
Good morning, Singapore. It's Glenn, the Flying Dutchman. Andre and Shaun are here, and so is Dr. Geraldine Tan from the therapy room. Very timely that we're talking about bipolar disorders today because, as I mentioned early on, right? I mean, Andre and myself just got involved in this Instagram thing that we're doing, raising awareness of mental health issues, post-traumatic stress disorders, and so on. And I guess bipolar disorders fall in this category as well. So what we're trying to do is get people to seek help if they need to.
Yes, and if you need contact details for all the different bodies, at the bottom of our post is a link to all the government.
That's right.
Bodies.
I think it's a gov.sg.
Yes.
You can get it if you have the gov.sg app as well.
That's right.
There are helplines in there for people who are contemplating, suicide.
Yes.
For whatever reason. Please talk to someone.
Yes.
Questions coming in for those who have joined us a little later. Can a child have bipolar? Yes, Jerry has said it does. It has been seen in children, and it can strike at a very young age as well.
That's so tough, though, because for children,
sad.
They may not know how to express themselves. They may not know what's going on inside of them, right?
Yeah.
So if they don't talk to someone, maybe parents who are listening in right now, if you observe your child is behaving differently, maybe you should be the one to ask your child how he or she is feeling.
That's true. And earlier we spoke about the electroconvulsive therapy. Someone's asking how long does each session not how long the session lasts, but how long does the therapy last for the person?
How long does it work for?
Yeah.
The process or the procedure itself is really quick, and then they go into recovery.
But how long is that effective?
It depends on how severe, sometimes it takes a few sessions. So the doctors sometimes have it alternate days for 3 to 6 sessions or even more. Sometimes it's every 3 days they have one. So it depends on how severe it is, and the doctors will toggle.
Wow.
Yeah, and then the effects may last, anything from 2 weeks, I suppose. Yeah, to it should work. I'm saying if you do any therapy, it should work. But the thing is, the human brain is so complex and dynamic. Sometimes it is very hard to predict how effective it will be.
This question from Charmaine has really thrown me off. Is it advisable for them to get married or stay single for life?
You'll be surprised. Many of them are married. Like earlier, the man that I was talking about, he even has grandchildren. So we should not stigmatize them. They can live
absolutely.
a very full life, and they can live a very happy and contented life also.
Absolutely.
I think that I learned this a long time ago. I think people who have conditions like this, you have to understand the meaning. You're not diseased.
Yeah.
You have a condition that can be managed. You can live a normal life.
Yeah, and that's why we have campaigns now.
Yeah.
Because we don't want people to as you mentioned, stigmatize others with these conditions.
Yeah.
You see.
Absolutely.
They're so misunderstood.
They are. They're very misunderstood. Very, very misunderstood.
Life is tough enough as it is already without people, stereotyping and stigmatizing them.
That's right.
I agree with that.
And
Absolutely.
Malcolm Thumb is asking, do you see an increase in bipolar cases during this pandemic?
I see a lot of depressed cases, anxiety cases, but not bipolar. It doesn't just increase because of a pandemic.
Yeah.
Okay.
But in terms of people feeling depressed and being anxious and all that has certainly gone up during this period.
Yes.
I'm just wondering, as the world changes and as the world evolves, whether the instances of bipolar are increasing because of the pressures life puts on us now that, say, our grandparents didn't have.
I suppose if we use that, across all the disorders, we are seeing an increase because there's also more awareness.
Okay.
So
Well,
the pressures and awareness cause an increase. It's like your COVID swab.
Yeah.
The more you find.
the more you swab, the more you find.
Yeah, very true.
Okay. Thank you so much for all your questions on Facebook. Thank you for joining us, Jerry. Always a pleasure. And we look forward to seeing you next week. Any parting words?
Two things, actually. One is, whatever that we discussed today, you think you have a disorder, please go to a psychiatrist or a psychologist. Don't diagnose yourself. Okay, that's very important. The last thing that I want to give is hope. One of the writers that I really love, Ernest Hemingway, has bipolar, and he says courage is grace under pressure. So I want to give that to everyone.
True.
All right. Beautiful. Thank you so
Jerry.
much, Jerry. Thank you so
No
much.
worries. And I'm glad the sound worked today.
Yay!
All right. We will see you next week. You have a wonderful week ahead.
You too. Bye.
Bye-bye, Jerry.
Bye-bye.